Hello, this is Ann Robinson, and I'm here at the NACCHO Annual 2013 conference in Dallas, Texas, and we're going to talk a little bit about branding your local health department in just a minute. Welcome back, and I am here and shared with Barbara, and she's from Riverstone Health out of Billings, Montana. Barbara, welcome, and thanks for coming and meeting with us.
Well, thank you for having me. I'm really excited to be here at NACCHO. I think it's a great opportunity to talk a little bit about what we did with our local health department and our journey from Yellowstone City County Health Department to Riverstone Health.
Thanks. Well, let's start by, why don't you give us your full name and what you're doing at your department, and then let's go into that initiative that this journey that you guys have gone through over the last couple of years.
Yeah, my name is Barbara Schneeman, and I'm currently the Vice President of Communication and Public Affairs with my organization, and I've been there for about 10 years. But prior to my being a staff person at the formerly known Yellowstone City County Health Department, I was a board member, and so really have had the opportunity to look at the organization over the last 10 to 12 years and see how it's grown by leaps and bounds. Really, our journey began many years ago in like the late 80s, when we started looking at what do we need to do and how do we need to position ourselves. And then in 2002, we went after and were successful in getting a permanent public health mill levy. But as a part of that mill levy, what we really needed to do was put together kind of who we were. We didn't know if the community knew who we were and would give us an opportunity to get some more tax dollars to support the work that we did in our health department. At that time, we went out with a survey and found that less than 30% of the people in our jurisdiction even knew who we were or were familiar with who we were.
And I'm sure very common terms that we've heard about, and working with other colleagues that I've worked with, they just think public health, all we do is give shots and work in a dingy old place.
Exactly. And so what we really needed to do is we needed to prove who we were and why we were valuable. So really, we were successful in putting together that public health mill levy campaign. The voters said, yes, we value what you do, or maybe they didn't know what they were voting on, but either way, it was a good outcome. Yes. And then afterward, we were, kind of taking a look and saying, okay, well, the voters have now given us more additional funding, and we have a responsibility to them to be good stewards, so we need to communicate better about who we are and what we do, so that they continue to see that the money that they're giving us really is spent wisely. So really that began our branding journey, and it began with the Board of Health saying, staff people, you need to fix this. And so we really began to think a little bit about what we were doing and how we were doing it. And then in 2007, we decided that it was something that we couldn't do individually as staff members, and so we hired a communication firm to help facilitate our journey. And the journey really did take us a good, I'm going to say 18 months from where we started with the board members saying, go and do good things, to actual implementation of a new brand and a new health department now known as Riverstone Health.
And what did the community, how did they embrace this change, or what results did you see from the branding?
It's really been interesting because we've now been Riverstone Health for 5 years now. And so if we recall back in 2002 when we did kind of an initial baseline survey of less than 30% of knowing who we were, this last market research survey has shown that clearly 88% of the people in our community know who we are and are familiar with what we do. So it's been tremendously successful for us. And we've increased our funding levels. Last year we had a budget of $31 million, And way back when we started on the journey, we were probably around 18 to $20 million a year. So, and I will say that we're a little bit different health department. We have 4 service lines, and we have your traditional public health service lines of environmental health and WIC and population health services. But we also provide home care and hospice services. We have a community health center, or an FQHC, that's associated with us. And then we also have educational health services, where we are the first family medicine residency graduate medical education program in the state of Montana. So we educate family physicians, and it's really phenomenal that of our graduates, clearly over 70% of them have stayed and practiced in the state of Montana.
That huge results.
Tremendously large results.
And what a collaboration, bringing those 4 entities together, and to be able to maybe have those physicians working in your FQHC and on some of those other programs in your community.
It's really nice, because what we're really seeing is that intersection between primary care health services, and service delivery, and public health. So we're really looking at things from a very broad perspective. And so internally, from a staff perspective, we get a lot of synergy. And people are not only working, they're working beyond their silos. And I really think that from our branding perspective, before we branded, we were really in our silos. People were very territorial, and now they're looking much bigger and saying, okay, well, how can we connect people to the services that they need, not only within our organization, but also with different service providers across the community, so that we can really help people lead a better life.
So how did you overcome the challenges of people understanding what public health is or do provide, what type of services they provide in the communities? That took us a really long time in our branding process journey, because we were trying to define really internally what we did. And there were some people who said, oh, well, we provide health services. And then there were other people who said, no, we provide public health. And then, even like down below at the, very baseline level, people said, no, we provide, dental and WIC. And so what we really had to do is we had to look at a much higher level, the 30,000-foot level, if you will. And really at the end of the day, we decided that we connect people. I mean, that was the business that we were in. We were in the connections business. And from there, we had to figure out how we explain that connections business. And so we went to look at providing a new mission statement. And basically at the end of the day, every single one of us who works in that department, we improve life, health, and safety. It's as simple as that. Very simple.
It's as simple as that. And we do that by providing health, education, leadership, and protection, or help.
Oh,
yeah.
Perfect.
Yeah, so, and we have a very simple tagline that every single one of our staff people understands and knows, and it's connecting you to a better life. And not to say that we are judgmental about how people live their lives, but wherever they are on their life journey and their life path, we really want to connect them so that they can achieve the goals that they have for themselves and their families and the community.
Well, outstanding.
Yeah.
What are there any new projects on the horizon, or what are your next steps to build on the success that you guys have?
What we've really started looking at doing is really trying to drive home that quality piece. And so we're involved in a lot of quality improvement initiatives. One of the things that we just did on Monday is we submitted our FAB documentation for accreditation.
Congratulations.
Thank you. It was a big journey. Yes. So our board decided that if there were any kind of programs and services that could be accredited, we wanted to make sure that we did that. And we were just this last winter notified that we were granted designation as a patient-centered medical home under the 2011 standards. And we have 3 community health centers that are associated with our organization, and all 3 of them individually were awarded this designation. So we're always continuing to look for new and better ways so that we can show the value that we bring to people's lives in our community.
Well, and what a model, again, just incorporating all those resources and just, I mean, Billings isn't a huge, you know, we've been talking to people from New York and Los Angeles, but really just a great sized town to have such amazing services.
It really is. I mean, we have a county of 150,000 people, and it's the largest county in the state of Montana. Billings is the largest community in Montana. You know, Montana is 4th in the nation as far as land mass, but we have about 1 million people. So there's really opportunity for people to get to know each other, and I think because we know each other and we trust each other and we like each other, we have opportunities to maybe get things done a little bit more expediently than some other larger population centers.
Well, thank you. Thank you so much for taking the time to talk with us today and coming to this conference and sharing all of your successes. If people wanted to find out more information about your program and or to get in touch with you, where would they go?
You know, they can go to our website, and that's riverstonehealth.org, or they can call me directly at 406-651-6420.
All right, again, and thanks for coming on the show. And to find out about more other innovative programs and other great topics, continue to watch the show here at the NACCHO Annual 2013 Conference in Dallas, Texas.